All right. Hello, everyone. This is Dr. David again. Welcome to tonight's very, very special webinar with Alice Bast. And I tell you, you are in for a treat. I know I say that sometimes, but I mean it especially so this time. Alice Bast, our presenter, I'll be introducing her later on in this presentation, and I'll read out her bio. But I have to say this. This is one person I went to listen to when I was in Dallas a couple of weeks ago, and I was just enthralled. And so were the rest of the people in the audience, just listening to her story and how she started with pretty much zero and started with a movement of awareness, rallying medical professionals, speakers, lay people, average non-medical professionals, to do what is so, so important, what really should have been done a long time ago. So we are really, really honored and really grateful that she could make it today. For those of you who don't know me or know about Building Strength webinars, I'm Dr. David, like I mentioned, and I am a co-founder and the host of these webinars. We've been doing these now for about, let's see, now 4 years, a long time. The goal when we first started remains the same. But before we talk about the goal, we want to talk about our mission, is to help people really understand what health is all about. And I know there's a lot of information on the internet, there's a lot of information on TV, and you go to the hospital, your doctor gives you information. But our goal was to help people take control of their own health so that they can think intelligently and make the right decisions when it comes to treating their minds and their bodies. Of course, that does not negate the doctor's care and advice, but I think it helps actually makes the doctor's care and advice even more effective. The second part of our mission is to help point you to the best resources out there for taking care of your own health, and we're doing just that with this webinar tonight. I tell you, this is just crucial information that people need to know about. The National Foundation for Celiac Awareness has done a lot of good work, so I think everybody needs to know about it, even if you are not, even if you don't have celiac disease or you're not gluten sensitive. You need to know this for your friends and family. And that's our vision in front of you, to be recognized as a trusted resource for obtaining valuable and practical information related to health, strength, and human effectiveness. I guess we've been doing that for over 4 years. If you need to go to our website, that's buildingstrengthwebinars.com. We have over 400 videos, wonderful videos that can help instruct you in all these different areas. I know that there are people actually listening on the phone and who cannot see the slides. If you have any questions, you can send us an email and we will answer your questions. If you are on the computer, you can type in your questions in the top right-hand corner of the screen. Anyway, enough housekeeping for now. Let's get on to the main presentation. As always, we'd like to point out that these presentations are not intended to be a substitute for a doctor's care and treatment and advice. Please check with your doctor before you make any drastic changes. Very, very important. Recordings will be available. We'll tell you how to do that at the end of the presentation. Okay, I'm going to bring out Alice's bio. That's Alice right in front of you. And let's start. Alice Bast founded the National Foundation for Celiac Awareness in 2003. Her personal experience with celiac ignited her passion to help the estimated 3 million Americans suffering from the disease receive a prompt and accurate diagnosis. She is widely regarded as a celiac expert and has been a keynote speaker at major medical and food industry events nationally and internationally, including, there's a list of associations she has worked with, including the American Pharmacists Association, Healthy Foods Conference, International Pizza Expo, the Flavor Experience, and on and on and on. She has been busy. A couple of the things that really stand out, really stand out to me, the fact that she has had a grant from the National Institutes of Health. She's also working on a grant from the FDA. She actually got gluten-free diet foods into Walmart, and I'm sure she's going to tell you a lot more about that, and also into Whole Foods. And let me go on. Her organization, NFCA, drives diagnosis of celiac disease, improves quality of life for children and families adhering to a gluten-free diet, and facilitates collaborations with the healthcare community. NFCA is a leading resource for celiac information and offers free information and support materials for celiac patients and their families. The organization is also a leading resource in accredited training for healthcare providers and food industry professionals. To learn more about her work, you need to go visit celiaccentral.org, and she's going to be talking about that as well. Alice, I have to say it's been an absolute delight and pleasure just meeting you, listening to you on the stage, and I'm so grateful that you were gracious enough to heed my invitation and to come onto this presentation. Thank you so much for being on. Over to you.
Oh, well, thank you, Dr. David. Thank you so much for inviting me here this evening. And for anyone who's on the webinar, I'd love for this to be interactive. So don't forget, please, type in your questions, ask me many questions. I'd love to know, who has celiac disease, who's on the webinar, who, might be gluten sensitive. So that we could, really have an interactive kind of presentation tonight. The presentation might be a little bit different than what you're used to, because not only am I going to talk about celiac disease and gluten sensitivity, but I've been asked to speak about how does one go about turning their passion into a life purpose. So I hope you'll enjoy the little journey that we're going to take. And again, please feel free to ask lots of questions, and I will endeavor to answer them.
Alice,
yes?
Alice, if I may quickly interject, we have the polls all set up. So we have the 4 questions that you would like to ask, and once in a while we can break for a minute or so and have people answer a specific question and get feedback from them. So whenever you want to do that, you just let me know.
Okay, perfect. So why don't I start in with who is Alice Bast. Always like, to talk a little, a very little bit about, why I started the foundation. Why does anybody do the work that they're doing? So I don't think I even need to introduce myself because Dr. David did it so well. I do have celiac disease, and I have a number of passions, including my family, and you'll get to see some pictures of my daughters. Raising awareness of celiac disease. I'm really pretty fanatical about a healthy lifestyle, about great food, about health empowerment, and how you can take your health into your own hands and take control of your life so that you can live a long, healthy, and fulfilled life. Now, I was not always healthy, and my story goes back many, many years ago. Unfortunately, I, like most sufferers with celiac disease, had symptoms from the tip of my head to the bottom of my toes. I actually saw 22 doctors. So I had, unfortunately, I had a full-term stillborn child, 3 miscarriages, a 2-pound baby. I lost 25 pounds. My hair was falling out. My teeth were brittle and starting to break. I went from doctor to doctor, as I said, and the doctors, whatever the symptom was, the doctor treated me. So for the migraine headaches, I got Imitrex. So for my anemia, I was told to take vitamins, and I was told it was all in my head. And finally, a friend of mine who is a veterinarian, and yes, a veterinarian, said, sometimes dogs have trouble with gluten. And I'm like, what's gluten? And she said, it's a protein component of wheat. Maybe it's gluten that's causing your problems. And sure enough, doctor number, this was doctor number 23. I went to him and said, can you test me for something to do with gluten? And he said, you can't have that disease. It's, it's a childhood disease, and you're too tall. And I said, well, what's the blood test? And he said, it's a serology test. It's it is a blood test. And I said, well, here's my arm. Well, sure enough, I had celiac disease. They went in and did something called an endoscopy. The villi in my intestine were flattened. And when the doctor finally, diagnosed me, he said, well, the good news is we know what's wrong with you, but the bad news is you can't eat anything. And the way he presented it sounded like it was a life sentence. But for me, it was the beginning of my life because my mother had died of pancreatic cancer, and I thought I was dying of cancer. So I was not given a life sentence of, pain and misery. I was given a new lease on life. I was given health. And that's the way I looked at it, although at the time you could not find gluten-free food in your local supermarket. I want you to know today, because Dr. David asked me this, he said, whatever happened to that 2-pound baby, that baby that you have? Well, here's a picture of that 2-pound baby. This is my daughter, Bibi. She's currently 18 years old at the University of Michigan, and there she is with her cousin. She's healthy, she's well, and thank goodness, for my gluten-free diet, and thank, goodness that I was able to get healthy. And that's what I'm hoping that all of you today can learn from my experiences and can help others and help yourself. So now you can see why I started this journey. I started it because I had a desire to spare other families from the needless heartache and the suffering that I'd been through. I really wanted to get the 3 million people that are out there going from doctor to doctor, properly diagnosed, and then the 18 million people who are sensitive to gluten, knowing that, the food that they're eating may be poisoning their body. The food that they are eating may be the cause of their symptoms, and maybe the medication that they're taking might be masking those symptoms. And wanted to make sure that gluten-free food was available and affordable nationally. So let's take a step back and find out what celiac disease is. Dr. David, this is where I'd like to take a poll. I'd like to find out how many of our listeners actually do have celiac disease. So can we stop and take that poll?
Absolutely. Okay, folks. We're going to the first question. Do you suffer from celiac disease? You should see it come up on your screen. We'll take a minute, click yes or no, and then we will collate the answers. All right. Wow, look at those numbers go. Okay. Now let's see the numbers. That's a pretty cool feature here. Okay. All right. 25 seconds into it, 76% of you have voted. Please, if you haven't voted, go ahead and vote. Let's round this up. 79% voted, 82% voted. More. Any more? Is anyone else who can vote? All right, we're 45 seconds into it, and 82% of you have voted. Okay. All right, well, that minute's over. And 56% say yes, 44% say no.
Oh, okay. So, all right. So for all of you out there, I'm sure you've all had your own personal journey on, celiac disease. So you know what it is. But for those of you that don't have celiac disease, celiac disease is a systemic immune disorder caused in genetically susceptible individuals by the ingestion of gluten and related prolamines. So anybody with celiac disease, when the person eats gluten, the protein component found in wheat, rye, and barley, it sets off an autoimmune reaction and damages the small finger-like projections called villi in your small intestine, which leads to malabsorption and leads to 250 signs and symptoms, ranging from, as we talked about, digestive problems like, anything from stomach upset, diarrhea, bloating, constipation, anemia, to, fatigue and in children failure to thrive. A simple blood test can help to determine whether the disease-specific antibodies are present and is the first step to diagnosing your celiac disease. Now, what is gluten sensitivity? So this is a whole new field, and the study of gluten sensitivity is in its infancy. It's in its formulative stages. Earlier this year, as Dr. David mentioned, I got to speak at a conference with Dr. Kenny Fine, and Dr. Kenny Fine and Dr. Vicki Peterson for many years have been talking about their patients coming in. They have this, they really have this problem where they don't have celiac disease, but they don't feel well when they eat gluten. So this year, a major international study on gluten sensitivity was conducted, in collaboration with the University of Maryland and University in Italy, and researchers were able to distinguish the difference between celiac disease and gluten sensitivity on a molecular level in terms of an immune reaction. And basically, gluten sensitivity is an innate immune mechanism that does not infect the intestine. So the person who has gluten sensitivity still has those same symptoms. So abdominal pain, eczema, fatigue, headache, mental confusion, diarrhea, abdominal swelling, anemia, constipation, but they do not have the villus atrophy. So that means when the doctor goes in and does that biopsy to the small intestine, there is not that villus atrophy. And currently, because the field is in its infancy, there is not an accepted diagnostic tool. There are lots of laboratories around the country. Right now, the definition of gluten sensitivity would be those cases of an intolerance due to gluten which is possible to exclude celiac disease. So that means you go in, if you're coming in with a symptom, you go in, the doctor will exclude celiac disease due to a negative result in the serological markers, and then exclude a wheat allergy. So, and ensure that you're not suffering from a wheat allergy. It's very important for the physician to take a case history as an investigation for the diagnosis of gluten sensitivity, and then the patient, the sufferer, is put on a gluten-free diet, and experts recommend a double-blind gluten-free diet. So if you look at this side-to-side comparison, you can see that 1% of the population, or 3 million Americans, have celiac disease. Unfortunately, still 95% of these folks are undiagnosed, so we still have a lot of work ahead of us. And now, there was another study conducted, published actually by Mayo Clinic and Joe Murray, that is saying that celiac disease the prevalence of the disease itself is on the rise. So more like 2% of the population has celiac disease. The prevalence of the disease is actually increasing. So what's going on in our environment that's making that happen? On the other side, gluten sensitivity, look at this. 6% of the population, that's 18 million people, have gluten sensitivity. And the treatment is the same. The treatment is exactly the same. It's a gluten-free diet. So who is the NFCA? The NFCA is the foundation that I founded in 2003, as Dr. David mentioned earlier, and it's a nonprofit organization dedicated to raising awareness of celiac disease and gluten sensitivity, both for the general public and the healthcare community, and to facilitate research to better understand the causes, the mechanisms, and the treatment of the disease. And what we do all day, every day, is raising awareness. We like to do it. We launched an awareness campaign, and you'll see some of our programming as we go on with the webinar 7 years ago, so that that all the people out in the United States that are undiagnosed got properly diagnosed, so that we don't want the average person to be suffering for 10 years, and that's what it's been, 10 years going from doctor to doctor to doctor, wondering what's wrong with them. And, I have a story about this. I was working in Washington, D.C., and there was a gastroenterologist who had mentioned to me that he had no patients in his practice with celiac disease, and what was all that's going on with gluten-free? He said, what is happening with gluten-free? Why is it everywhere? This is some kind of fad. And I said, well, are you testing for celiac? And he said, no, I'm not testing. I said, well, can you do me a favor? Can you start testing for celiac disease and, and see if you find any patients with it? So, he's talking to somebody who had a full-term stillbirth, 3 miscarriages, and a 2-pound baby, and he's calling it a fad. So he went away, and a year later, we reconvened in Washington, D.C. for some advocacy work, and he said to me, you know what, Alice, guess what? I'm diagnosing 2 patients a week. Yes, 2 patients a week with celiac disease. You know, thank you so much for your symptom checklist. The following year, guess what? His own daughter was diagnosed with celiac disease. So this is what, you know, I'd like to talk a little bit about, is that you as the patient need to be educated and taking your health into your own hands. And our medical community also needs to be educated, but it takes about 10 years for the medical community to change their practice of medicine, and we're all in this together to do that kind of work. Additionally, we launched our program this year, our Gluten-Free Children Safe campaign, which is our program in the universities and the school to ensure that the foods that we're eating, because again, the food is our medicine, gluten-free food is safe for our families to eat. Now, I don't do this alone, and this is really, really, really important. You can see all these women on the screen. Yeah, there aren't any men, just Dr. David here. So it's an all-women organization all together helping you execute lots of programs, and you'll learn a little bit more about the programs, you know, raising awareness, our kids' safety, our training programs, and also some of the grants that we received, and we're really, really excited to help you and for you to help us. So let's go into some of these programs.
I just want to mention really quickly, Alice, just want to mention really quickly that some of the audience members are asking if there's a poll for gluten sensitivity. I know we did one on celiac disease, but
oh, sure, we do.
Anytime you want to do it. Anytime you want to do that.
Okay. Well, why don't we go right into find out who in the audience is gluten sensitive?
Okay. All right, folks, get ready for the next one, gluten sensitivity. All right. We'll go for another 30 to 45 seconds for this, so we can get back into the presentation. So go ahead and answer your question. Answer the question, yes or no, if you are gluten sensitive, excuse me. All right, about 72% voted. 77% voted. Now, last time it was 54%, or 59, I don't remember now. Was it 54 or 59 that were actually, 59% was celiac disease positive? Okay. All right, folks, who else needs to vote? Last time we had 82% voting. 77, this one is 77%. Okay. All right. One more person needs to vote. Okay, good. We have 61% say yes, they are gluten sensitive, as obviously 39% are not gluten sensitive. Okay. Thank you, folks. Get back. Now we'll just get back into the presentation.
So for all of you folks out there that are gluten sensitive, if you look at this list here, it's very, it is basically the same signs and symptoms: the abdominal pain, eczema, skin rash, fatigue, headache, mental confusion, diarrhea, abdominal swelling, anemia, constipation. And actually, we are launching, we have a Do I Have Celiac brochure. We also have a Do I Have Gluten Sensitivity brochure that we're launching too. Again, so that we can ensure that everyone, you know, is properly diagnosed, and you know that it's not something that is seen as this fad weight loss diet. You know, so many times people will ask me, you know, can I lose weight on a gluten-free diet? And the answer is, of course you can lose weight on a gluten-free diet. If you cut your calories, you can lose weight on any by cutting down your carbohydrates. But it is not specifically, you know, a weight loss diet. It is a medical necessity for many, many millions of people. And I want to go into a little bit more of our programming about how we try to be fun at the organization and how we went about our guerrilla marketing to ensure that the medical community and the chef community really understood how food was our medicine. And so one of the ideas that I had early on, and actually it was working with a group of students from Drexel University helped me come up with this idea, is we came up with a gluten-free cooking spree, and we did these events in cities around the country. We started actually in New York City, and you can see that person right in the middle of your screen is Heidi Collins, and Heidi Collins was on CNN. She was a newscaster. And so we covered this in different major marketplaces. We had the doctors partner with chefs. Yes, doctors partnered with chefs. And the doctors learned all about how food could be our treatment. And then, of course, we have anywhere from 400 people to 2,000 people in attendance for these events. We had a great deal of fun. But believe me, it's not been always easy. Along with the fun, we've had lots of different experiences, and I'd love to tell the story of once we were at CNN in their headquarters doing this event, and what happened at CNN was we brought down the power. It was quite interesting. We are very fortunate because Sanjay Gupta entertained all of us, so you had 400 hungry people, and you had no power. But the power came back up. But before the power came back up, everybody turned to me and said, what are we going to do? Well, the only answer I had was call an electrician. So it's not always so easy. We've also had some, we did an event in San Francisco, and the bridge was closed, and we couldn't get to our location. And, we've had a little bumps along the way, but we also have a lot of fun in the work that we're doing. Not only are we having fun in our work and in our events and creating awareness through lots of, very creative ideas, we also have training programs. And the training programs, every chef that cooks in one of our events has to go through our great training program, which is our gluten-free resource education and awareness training. That we have launched out into the kitchens, the chefs, the restaurant community. We also have a healthcare community education program as well. And we have trained restaurants around the country. We've also worked with a food company called Schwan, which makes those little gluten-free pizzas that should be available in the universities and into the colleges and in the public school systems, so that your families will be able to get gluten-free food in their schools and in their communities. We've also been very involved in the Food Allergen Labeling Act. As all of you are aware, you can see now gluten-free labeled on many, many products, but it's not always, it's not the case that the FDA has a standard right now. So let me repeat that. Right now, there is not a definition of gluten-free. And this year we partnered, there was an organization called 1 in 133, and NFCA collaborated with other celiac advocacy organizations to create this gluten-free wedding cake, a gluten-free cake, to really get the FDA to take notice that they really need to establish the gluten-free labeling. And it worked, and again, it was many, many people together, and we were really fortunate for 1 in 133 for organizing such a phenomenal event. And hopefully, third quarter of 2012, the FDA will have a standard in place. Next, we have a free primary care education program, because doctors, again, need to know the proper signs and symptoms of celiac disease so they can, increase their diagnostic rates, and they can be your advocates. They can be your partner in your health. But I don't want anyone to forget that this is all, if you're looking in the medical community, it's team approach right now, and it's team, it's a whole multidisciplinary approach. So you'll be seeing your primary care physician who will refer you to your gastroenterologist, who will refer you to a dietitian, and then you're going to be seeing your nurse. You might be seeing an allied health professional such as a mental professional, and also it's really important that your pharmacist is trained to understand the signs and symptoms, the drug interaction, and also the fact that gluten can be in your medication, which leads me to the next subject. We've been very involved in a program called Gluten and Medication, and it's very exciting to us. As a matter of fact, we were awarded a grant, and you'll learn a little bit more about that, to study the fact that how much gluten in medication is toxic to somebody with celiac disease. In 2008, we partnered with the American Society of Health System Pharmacists in creating this continued education program. And then we participated and we organized, actually, with the FDA, a public workshop on prescription drug risks and benefits. And then I was invited to speak at the American Pharmacists Association annual conference. So if you go to our website, you'll see that we've launched a program for pharmacists, which is very exciting. Now, back to what we can do and how we get involved with our community, and how we try to be really positive. We like to have fun. And one of the ways that we like to have fun, and Dr. David, we talked a little bit about health and what does that mean to us. We like to highlight people that are that have taken on the gluten-free diet.
Oh, looks like we lost her briefly, folks. Hang on just a second.
Okay, so let me tell you a little bit about our awareness advocates, our athletes for awareness. So what I want to tell you about this picture is we like everyone to understand that we all go through all kinds of trials and tribulations, but our awareness advocates are out there every day, all day, on a gluten-free diet, and it's kind of the before and after heroes here. So my first hero is AJ, and AJ came to me when he was about 10 years old and said, you know what, you helped me get diagnosed with celiac disease, and you know what, I'd really like you to sponsor me. And I said, sponsor you? What does that mean? He said, well, will you sponsor me because I want to go to the Olympics? And I said, well, tell me your story, AJ. And he said, okay, well, when I was a little kid, I was sick every single day. Going to the school nurse was a subject for me. I threw up every day in school. I was known as the sick kid. Then I got diagnosed with celiac disease, and I'm going to go to the Olympics. I feel great. And more power to him. I see him in his ski suit. He's got the National Foundation for Celiac Awareness. He represents celiac disease, and he's going to reach his goals. But one story I always like to tell about AJ is I said, AJ, tell me, if you had one tip for anybody, what would that tip be? If you had to tell some other child, give them a suggestion, what would it be? And I have to laugh because he said, carry a potato in your pocket. You can always find a microwave oven. So that's a tip from AJ. I learned something new, that I should be carrying a potato around in my purse in case I need a quick pick-me-up. Secondly, you can see Sarah Jane here. Sarah Jane was very sick before her diagnosis with celiac disease. Sarah got diagnosed, went on the gluten-free diet, and now she's on the LPGA tour. Yes, she is, and she's doing very, very well. Lastly, you see Peter Bronsky. Peter Bronsky is a triathlete, and he's published a number of cookbooks, one of them being Artisanal Gluten-Free Cupcakes. And he's one of our most amazing advocates. And, for any of you, no matter what you're doing, if you're even just going out and walking around your yard and want to be an awareness advocate, we love healthy messages. We'd love to hear your stories and hear how, you're empowering yourself to be healthier. And then next, we've recently launched our Kids Central. And this is, we're really excited about this. If you go to celiaccentral.org, you'll have lots of free information. And again, everything on our website is entirely free. We have games, guides, articles, and we have a very popular part of the site, which is Ask the Pediatric Gastroenterologist. Dr. Ritu Verma is our pediatric gastroenterologist from Children's Hospital of Philadelphia. And so we have that there as a resource for you. We also have lots of kid-friendly, gluten-free recipes, kids' questions and answers, and you never know what kids are going to say. They ask lots of great questions. We have our hot products blog as well. And, you know, again, kids and adults are a little bit different, but one of the most popular spots on our website is our hot products blog, because on a daily basis, yes, we get people giving us food nonstop. So if you work for us at the foundation, you get food shipped to the door. We have taste testers tasting the food. We have our fundraising, because and a letter writing campaign, because again, we do not have any kind of membership here, so we rely on donations, just like people like you or our donors. We have pep talks, because everybody needs a pep talk. Some people need pep talks. You know, you could be self-empowered, or you could need a little bit of help, because it's not always easy being on a gluten-free diet. You want to be like your friends. And, sometimes it's best to get it from your peers, for your peers to help you. And what we tell kids is that everybody has something. Some people need glasses. Some people are on, have a peanut allergy. And you happen to have, be gluten-free. And how do you handle these social situations? And one of the stories I like to tell is talk a little bit about, when somebody's going out on a first date, what do they say? What are they going to do when they're going to kiss somebody for the first time, and that person's eating gluten. So there's a lot of social situations we have to get over here, and so there's lots of great information, and we'd like to share that with you. So Dr. David, do you think we want to do a poll question here?
Absolutely. Let's split up. Which one would you like us to do? We've got gluten-free diet. We've got healthcare professional.
I'd like to know, so I think almost everybody, before we go into the empowerment slide, I'd like to know who is on a gluten-free diet, because it looks like we have almost, this entire population is either gluten-sensitive or celiac, so I'm thinking that almost everybody is on a gluten-free diet on this webinar right now.
You can't be so sure. Let's go ahead and see. All right, folks, do this in a few minutes. Some people don't know how to click or how to answer the questions. Just hover your cursor over that circular button next to the yes or the no, and left click on it, and that will register for us. Okay, see already 78% is vote. 81%, 80%, good. Okay, well, you guys are responding a lot quicker now. Okay, 79%, Alice, are on a gluten-free diet.
Okay. All right, so let's talk a little bit about this gluten-free diet. So empowerment is key, and I know that, everybody starts to say, oh my gosh, I just crave the pizza, I crave beer. Well, listen, life is getting better. If you think you can, you can. And if you think you can't, well, let's not even go there. There are challenges that are inherent to the gluten-free diet, but you know what? Life has gotten so much better. I remember when I was first diagnosed with celiac disease, and that was 18 years ago, when I went into the grocery store, there weren't any products on the shelf labeled gluten-free. Yeah, I could eat the perimeter of the supermarket, but I couldn't buy a loaf of bread. And life has gotten so much better. It really has. So the first tip that we have is really, we'd say to own your own, your own diagnosis. Own, it's in the beginning, it's okay. You're going to mourn those foods that you craved, and that's why I hate to be talking about beer on a health webinar, but there were a lot of people coming in to us and saying, you know what, I have a family member who's cheating and they're drinking beer. So we actually initially worked with Anheuser-Busch to help them, create the first gluten-free beer. So, don't feel sorry for yourself. Let's figure out what we can do to empower, our community to make those changes. We are not going to miss the donuts or the pizza, and actually there really are great gluten-free pizza out there. And but don't forget, there are foods that are naturally gluten-free. They're delicious and they're nutritious. And if you have celiac disease, you have an autoimmune disease. If you have gluten sensitivity, you're also sick as well. So we all have to focus on what's good for us and not just what's gluten-free. So it's really important to put great fuel into your body. So look at this slide here. Some of this great fuel are fruits and vegetables, nuts and legumes and whole grains, quinoa, brown rice, and as we talked about before, living a very active lifestyle, and this will all give you a great quality of life. And I have to say, with our gluten-free cooking sprees, the first time I started working with the chefs, they had never cooked with some of these grains, and they looked at me, and then this is the chef training program and the gluten-free cooking spree in New York, and one of the chefs said to me, you know what, I'm not sure what to do here. I have no idea. And I looked and I very confident and said, oh, you'll have fun with quinoa. Let's make quinoa 5 different ways. And you know what? Now there are restaurants that specialize in gluten-free food around the country. And, so experiment with these grains, experiment with the quinoa, experiment with the brown rice. These foods can be very tasty and great for you. And buckwheat is a great gluten-free grain. It might be, it's actually a family in the rhubarb family, but it's very, very tasty. And don't forget to get regular exercise, and it'll help you improve your quality of life. Also, what I like to tell people is that they should tell somebody about celiac disease or gluten sensitivity. You might think I'm a little bit weird, but you know what? I'm not quiet about it at all. And I love to tell people about the elevator experience. So when you're in an elevator and you're looking at the floor and then you're looking at the ceiling and you don't know what to say, have you ever thought about saying, do you know what celiac disease is? Are you on a gluten-free diet? Have you ever heard of gluten sensitivity? Open it up. You know what? You might really help somebody that day. And then you can join a cause. There is lots of work that needs to be done here and with other organizations. You can volunteer, you can advocate, and you can share your story. The National Foundation for Celiac Awareness needs people like you to help. They need you to volunteer, need you to tell us, what you've been through, why you're on a gluten-free diet, what are the successes, what are the difficulties, because we love to hear from you. We like our website to be interactive. And then also you can get involved by spreading the word. As we mentioned earlier, we have a physician training program, we have healthcare provider training program, and we have a restaurant training program, and it's all under our great umbrella, which is our gluten-free resource education and awareness training. You can go to www.celiaclearning.com, again, www.celiaclearning.com, where if you are a medical professional, so here, right here, maybe we can ask Dr. David, are there any medical professionals on the phone right now?
Sure. There are 2 questions
on the webinar.
I'll go ahead and launch the first one. So go ahead and type, respond to the first. 27% say yes, 30%, 29%. Going back and forth. So about 30% of our audience are actually medical professionals.
Okay, so for that 30% that are medical professionals, it's the www.celiaccmecentral.org. It's a totally free continuing medical education program where you can learn about defining, diagnosing, and managing celiac disease. We have 3 distinguished faculty presenters, Dr. Daniel Leffler from the Celiac Center at Beth Israel Deaconess Medical Center, Joe Murray, who is the director of the Celiac Disease Program at the Mayo Clinic, and Michelle Pietzak, who's the assistant professor of clinical pediatrics at the Keck School of Medicine in the University of Southern California.
Could we take this a step further and just we have a couple of options for what kind of healthcare professional you are. Just out of curiosity, folks, go ahead and just click on which one applies to you. Okay, so we have some nurses, some nutritionists, and others. Okay. Okay, so 30% nurses, 20% nutritionists, and then 50% others. Okay.
Okay, so we also have on on the website on the celiaclearning.com, there is a whole program for dietitians and nutritionists, and one for nurses as well. So they're all a little bit different. So we hope that you'll go to celiaclearning.com where you can log on and take our online learning courses, and they all come with continuing education. So that's a great thing. And here is, if you'd like to see, this is the main website. So just to give you an overview of what the website looks like, when you log on, you can learn about the foundation, again, learn about the signs and symptoms. Also, there are the resources, and all the resources are free. So if you are a practitioner, so the nurses, the dietitians, if you want to download any of the information, we have a getting started guides that will go through the diet. So if you need more information on the gluten-free diet, what grains are acceptable, what grains aren't acceptable, so we have a listing of all those wonderful grains like amaranth, buckwheat, chickpea, corn, flax, legumes, lentils, millet, potato, quinoa, rice, all those gluten-free grains, the sorghum, and then some, recipes and how you manage the gluten-free diet. So again, we do have that free getting started guide. We also have the symptom checklist that you saw earlier in the presentation that we've distributed into doctors' offices and into hospitals nationwide. We've actually even distributed the brochures into grocery stores, because when people go into the grocery store and they're keeping a food journal and they're trying to figure out what's wrong with them, we figured that they might pick up the brochure and then ask their medical professional to test them. And then, of course, we love people to share their stories, and we have, we also have a program called Alternative Appetites. So for those people that need cooking lessons and need some tips on how to cook, because some people really, one of the most difficult things they find is they cannot, they don't know how to cook. They start out and they say, oh my gosh, they're like a deer on the road. Now I got diagnosed with celiac. What do I do? I need to eat on a budget. I don't know how to make or prepare food. So we have these little video series that will help them cook, and they're a lot of fun. The person that leads our Alternative Appetite series, Dan, he was actually on Blue Man Group, so he's an actor, he's a chef, and he has celiac disease. So he is so awesome and very entertaining. We also have our webinar series as well. In January, we'll be talking about food as medicine. We have a great dietitian, Rachel Begun. We're going to be talking about a gluten-free link to ADHD, autism, and celiac disease. We have a webinar on maintaining a healthy weight while eating gluten-free and the importance of physical activity. Believe it or not, a lot of people gain weight on a gluten-free diet, and that's something that nobody really, in the beginning when they're diagnosed, they don't realize, they might be underweight like myself, but you could be overweight, and then you go on a gluten-free diet and you keep gaining weight. And so we talk a little bit about that. We're going to have a whole webinar on what to do to stay healthy and the importance of physical activity. So we have lots of great webinars, and it's all on the website. And again, we would really like to hear, your personal story and love for you to get involved. So I thought, to really hit home and bring it all home for the medical professionals and any, patients on this webinar, some of the folks that work for me, I'm not the only person that, has been through this 10 years of struggling, or in some cases even more. This is Becky, and Becky runs our gluten-free resource education and awareness training program. And her story is almost similar to my story, except for Becky had celiac disease as a child, and nobody could figure out what was wrong with her. She was sick, she had fatigue, she had diarrhea, she had depression. Again, if you look at the symptom checklist and you go through all these symptoms, you keep hearing the same patterns again and again and again. She went from doctor to doctor to doctor, and unfortunately she was just treated for whatever the symptom was. So she went to tell me that she had fatigue, brain fog, vomiting, joint pain, weight loss, chronic diarrhea, constipation, sores in her mouth, mood swings, migraine headaches, sinus infections. In 1987, she was misdiagnosed because the doctor did not know how to take a proper biopsy, because when you go in and do the first step, as I said, is taking the blood test, the serology. The next step is the biopsy, and the doctor there was partial villus atrophy and not full villus atrophy, so when they took the biopsy, they did not get a piece of tissue where there was villus atrophy, so she was told she didn't have celiac disease. And then not until 1992, after the birth of her son, her symptoms became really acute, and she had diarrhea, bone pain, depression, weight loss, and she lost 30 pounds in 3 weeks. And now Becky has been she's been gluten-free for 20 years. And it's really pretty incredible. Her story is like my story. She's been well, and she's empowered to help others, and she's the director of our Gluten-Free Industry Initiative. And here's Kristen. Kristen was diagnosed in 2007 after a whole lifetime of pain and suffering. And she also, was diagnosed with things like, anorexia. The doctor's saying, why are you losing so much weight? She had, terrible problems with, depression as well. Same story. She's given medication, the medication for the symptoms, until finally she was diagnosed with celiac disease, and she ended up doing her master's thesis at Beth Israel Deaconess Medical Center on primary care education, and we recruited her to be our healthcare relations manager in 2010. So again, knowledge is power, and we just talked about earlier. We would love for everybody who's a medical professional and to check out some of our lifestyle and dietitian led webinars. We have a section on the website called Ask the Dietitian. We have our printable guides, our Getting Started guide, our gluten and medication guide, a guide for kids going to college, and that's an area that that's really been very difficult. I'm hearing more and more concerns. When that child goes off to college, what happens is they might start eating a lot more carbohydrates, and when they eat the more carbohydrates, it really flares their symptoms, or they get diagnosed with celiac disease at that point in time, or they're in the college or the university, and the food service cannot accommodate their needs. And that's what that's where our safety campaign, our Keeping Our Kids Safe campaign for 2011 is. We've launched that to try to get to the hospitals the schools, the universities, to ensure that our families are not getting cross-contaminated, and that the food service providers understand that, that gluten-containing food to us is poison, and they need to understand the safe handling practices. And again, all this information is available on the website. And what I'm hoping for 2012 is really that we can all give health, because I envision a world, and the NFCA envisions the world this way, that celiac disease and gluten sensitivity are widely recognized and treated, and that we have better, more accurate, and cost-effective screening methodologies. Gluten-free food becomes more affordable, it becomes healthier, and it's available where we live, work, and play, and that the research dollars are available to better understand the mechanisms behind celiac disease and gluten sensitivity, and that we can prevent the onset of these diseases. And we're all really, really into the health promotion model, and that's how do we keep ourselves healthy. I'm sure all of you out there, whether you're a patient or a practitioner, really understand the importance of keeping us healthy, and the health prevention, really the health promotion model where we look to stay healthy. And I like to talk about turning your passion into your profession, and how you can bring about changes. And as Dr. Mike was saying earlier, we're like, okay, well, the doctor, when he diagnosed me, he initially told me, Alice, you need to quit your job. You're not going to be able to eat out in restaurants, and told me all the things that I couldn't do. And I left there like a deer in the headlights. Like, what? I got to quit my job. I can't eat out in restaurants. I'm not going to live a normal life. Heck, I need to live a normal life here. All I have to do is go on a gluten-free diet, whatever the heck that gluten-free diet is, but I'll figure it out and I'll do it. Now look at our world. It's really gotten better. We're so excited. We started working with ballparks, actually nationally, on celiac awareness nights, to ensure that in the stadiums there was gluten-free food available, because, if you're a family and you're going to a ball game and the price of tickets are pretty dear these days, you want to ensure that you're going to have that full experience, and that your families can eat, food in the stadium, but also that there are, safe handling practices, and that the people that are serving you the food know that they shouldn't be touching that gluten-containing roll with that gluten-free roll. And that's why in May of 2010, the NFCA went to the National Restaurant Association show, and we created a vision. And what we did was the first gluten-free pavilion ever at the National Restaurant Association. And again, I want to say that none of this is ever easy. Anything that you do in life, you have your kind of trials and tribulations. And we created this pavilion with all of our vendors, and we had it all set up. We were so excited because there we were, the gluten-free pavilion, as you can see on this sign, where we had our great training program. Then there's this huge article in the Chicago Tribune saying National Restaurant Association has the first ever gluten-free pavilion. No mention of the National Foundation for Celiac Awareness. So you can see we can all learn, we all make mistakes, but in the long run it was a great thing, because the National Restaurant Association is now made the gluten-free pavilion standard, so that every year when they have their restaurant training, when the first food service executives come through, whether they're the chefs or the decision makers in the executive suites, they see
Uh-oh, looks like we lost her again. Hang on a second.
So if you can envision where I'm sitting in my office, actually they're knocking down a building right next to the office, and I don't know if that has anything to do with it, but the building is coming down, and during the day we have lots of noise, and everybody wears headphones in here, so I apologize. So to get back to the National Restaurant Association, we had lots of fun introducing gluten-free into food service, and it's really been pretty great. It's been taking off. We have our gluten-free resource education and awareness training program, in universities, in restaurants around the country, and you can see a listing of the restaurants on our website at celiaccentral.org. That's www.celiaccentral.org. Our great training program. And if you know of a restaurant that needs training, I was just in a restaurant this week that had a gluten-free menu, and the item was salmon with couscous. Yes, salmon with couscous. Couscous, for those of you who know about gluten-free, is not gluten-free. So there is a lot of folks out there that don't really understand what gluten-free is. And as we all know, gluten-free is not just wheat-free. It has to be free from wheat, rye, and barley. So there's a lot of training that needs to be done. We are on our way. And to show you how we're on our way, believe it or not, gluten-free is one of the top 10 industry trends for 2011. It's actually, the whole gluten-free industry is now a $6.3 billion industry. 15 to 25% of consumers are looking for gluten-free foods. So you know what? Awareness works. We count. Before, because people weren't asking for gluten-free food, so if you went into a school or a university, if nobody was asking, it's all about supply and demand. If people aren't asking for the food, then there will not be the demand, and nobody will be supplying the food. So it's really great that 15 to 25% of consumers are looking for gluten-free products. Now it's really important that we ensure that we medicalize this and ensure that our community knows that it's imperative that gluten-free means gluten-free, and this is not some kind of fad diet. This is a medical necessity, that we are a community of people with celiac disease and with gluten sensitivity, and that our diet has to be 100% gluten-free without any cross-contamination. And for those folks that are looking for an alternative to the gluten-free diet, I don't want to not mention the fact that there is hope on the horizon for medications as well. There actually are 2 medications, promising medications, one of them out of the university on the East Coast, which is looking to tighten the connections between the intestinal cells so that the protein cannot get through, and the other is an enzyme that will break down gluten in the stomach before it reaches the intestine. And also there's research in Australia on a vaccine, which is exciting as well, and the lead researcher on that project, Bob Anderson, is moving to Boston to continue his trials and his research into looking for a vaccine for celiac disease. So what I'd like to say is that we all have a voice, and I'd like to close with this, and we all can work together to ensure that our voices are heard, and like to empower everybody to, get up in the morning and make a difference, whatever that, that difference could be. It could just be planting a seed, and having a little herb garden. It could be, working with a child and teaching that child about good nutrition. But we can all work together to make a difference. And I'd like to open it up to any questions that anybody might have on celiac disease, gluten sensitivity, the work that we're doing to empower others.
Well, before we go into the question, yeah, can you hear me?
Yep. Hi, Dr. David.
Hi. Well, I just wanted to say before we go into questions, I just want to say I really applaud you, Alice, for what you're doing. This is just amazing. I mean, for all the things that you've mentioned, you would think you had a whole army of people working for you, and from what you just showed us, I mean, the picture of those of you at NFCA, 10, 11, 12.
Yeah, no, there's fewer than that. We're 8.
Oh, you're kidding. And you're getting all this done?
Well, we work hard. We work tirelessly, but again, we have lots of volunteers helping us, and that's why it's important for us to all work together. There are lots of volunteers out there, working to distribute the brochures. We've also, we were also partnered with a diagnostic company. We love partnerships where we delivered the brochures into doctors' offices around the country. We partnered with the grocery stores so that they can, teach a little bit about celiac disease and have, again, the brochures in the stores as well. But, we hope to keep growing so that we can, bring our programs and our services to all of you.
Absolutely, absolutely, and we would love to do whatever we can to help promote what you're doing as well. Just wanted to mention, folks, that this recording will be available. We will send you out information on that. You can all download it. You would just have to fill out a form, but you can have it. You can share it with all the people that you know. And I know we have some people from Australia actually logging in, and there's some questions that you might want to read through, Alice, on right down to your right. But please take these notes, take the recordings, share them with your friends and family, because people need to know about it. So many people I know, and if as a matter of fact, I think I may be gluten sensitive myself. I've had a test done, and I never knew that. I'd always had problems with digestion and stomach ache, and I just thought that, well, we black people don't have gluten. We don't. Gluten sensitivity is for white people. That's what I always thought. And I was shocked to find out that Dr. Gunji, who was at the meeting that I met Alice at, who is really from my part of the world, and he's gluten sensitive himself. So, is there any race prediction, Alice, or does it just cut across the board?
It cuts across the board, and that's one of the myths that we're trying to, dispel. That's such a great question. That's actually one of my passions, because it's, it used to be thought that celiac disease was a disease of, Caucasians. So, and basically you had to be blonde-haired, blue-eyed, and a child, and that is not true. I mean, there's actually a connection between diabetes and celiac disease, and, African Americans, it's black, white, it doesn't matter. I mean, it is an equal opportunity disease. So people can be gluten sensitive no matter, male, female, and celiac disease for that as well. So actually more women are diagnosed with celiac disease than men, and the same with gluten sensitivity. But women tend to go to the doctor more than men.
Right, that's what I was going to say. So that's probably because women are more concerned about their health than men are.
Yeah, but yes, and autoimmunity in general, more women are, have autoimmune diseases, because again, if you're looking at celiac disease, what you find is that, you need environmental, you have the gene, but you need an environmental stressor to trigger it, and a lot of times the environmental stressor could be pregnancy, and as we said, more women tend to seek medical care.
Gotcha. Okay, well, it looks like you can't find the questions on your end. Do you? It's just above the chat box, but if you don't see it there, I'll go ahead and ask the questions here. Okay, how do I get gluten-free? I'll just go ahead and ask the questions then.
Okay, thank you.
Sure. How do I get gluten-free food at my son's elementary school?
How do you get gluten-free food at your son's elementary school? So the first thing I would say to do is to find out the name of the person in charge of the food service there, and find out, who the food service provider is. So there's definitely, there are companies that that provide the food into the school. Find out who that is, and then I would, if you go to our website and you write to Becky, so it's BECKEE at celiaccentral.org. Again, Becky at celiaccentral.org. She can help you navigate how to get food into your son's elementary school.
Okay. Someone was asking. I'm here. Can you hear me?
Okay, good.
Someone was asking about how
Yep.
you get how do you train the chefs at the restaurants? I'm not sure exactly what it is. Go ahead.
Okay, well, there's the great training program. It's gluten-free resource education and awareness training. There is an online training program that the chef can go on. It's a train the trainer program, and they have a test that they need to take. They need to go through it. There's also a video training along with it. It's a DVD. So it's a DVD to learn all about bringing in the supplies, cross-contamination. We also have, in some cities, there's been a group of restaurants coming together that want to have seminars and in-person training, and we do those as well. We have folks that are trained to train the restaurant community. And again, that's our gluten-free resource education awareness training program.
Great, great. And this is a great question. I would assume that there you have probably a database of how people can connect with other groups, celiac awareness groups around the country, because Sarah wants to know how she can find someone in her area that has celiac. She's newly diagnosed just 3 weeks ago, and she feels totally lost.
Sure. So so Sarah writes in, we have a helpline. So if you go to the info at celiaccentral.org and ask to be connected to a support group in your area, what we can do is we can send out the Getting Started guide. Again, it's a free guide to you. We also have people, and actually they volunteer on our helpline, and they can help you with navigating the gluten-free diet. And then also, we can find a support group in your area. Or, it could be a support group, or it could be a hospital center in your area. But everybody's very responsive, and we're here to help you with navigating your diet. Especially, it can be so overwhelming in those first couple, weeks, month, even the first couple months, because you're trying to learn. You realize that, oh my gosh, well, soy sauce is made from wheat, so, it's really understanding some of the tricks.
Hmm. And I remember you mentioned something last conference about how even the wafers that the Catholic Church during communion, that may be a problem as well.
Yep. So that's been a big problem. That the fact that to take communion now there is a gluten-free host, which is good. But you really, again, you have to ensure that you empower yourself to ask those questions and insist that you have gluten-free hosts available or gluten-free food available. Whether it's it's really important to speak up. And if you feel like if you're going into a restaurant, one of the things that I recommend, and you don't want everybody to, let's say you don't want everybody to know, that you have celiac disease or gluten sensitive. You can quietly go back and talk to the waitress or the waiter and talk to the chef. It's really, and if you have the feeling and a recommendation, if you feel that you walk into a restaurant or you walk into a situation and they're being too cavalier, they're like, oh, trust your gut, because you know what, that's that gut instinct is really important. And and if they're going to just be too busy to take care of you, then maybe that's not the right place for you to be eating. And that's we do have lots of tips on going out, dining out, and making sure that you call ahead, and when you're learning to dine out, not going at very busy times. So there's lots of little tricks to helping you when you're initially diagnosed.
Fantastic. Fantastic. And the questions keep coming in. Is all rice gluten-free? I noticed that white rice is not on your list, and I thought it was gluten-free.
Yes, rice is gluten-free. So yes, I just had a couple. I put brown rice in there because I was talking about very healthy foods. So white rice, I mean, a lot of, many of the gluten-free products are made with rice. So white rice is gluten-free.
You know what you mentioned about going on a first date and being concerned about kissing your date, if you're sensitive. I thought that was really interesting. And Julie has a question along those lines. My son will be old enough to date soon. Do you have any questions, any suggestions about how he can safely handle it?
What I asked, I was stumped the doctor. Actually, I was in Norway speaking when I stumped the doctor with that question. You know what I say first of all is if they don't want the child doesn't want to say they have gluten sensitivity or they have celiac disease and they're on a if they're on a date, they just say I'm on a gluten-free diet. Luckily now it's acceptable. Like nobody looks at you like you have three heads. It's acceptable to be on a gluten-free diet. And then what you tell your date is, look, I'm on a gluten-free diet. I get it's really ask them if they could eat gluten-free with you. And that's the best way to handle it, because if they can eat gluten-free with you, then you don't have to worry. Now, if they're not going to eat gluten-free and you're going to go out for pizza and that person's going to have, pizza that has gluten and you have gluten-free pizza, then they're probably going to want to rinse out their mouth because it's a problem. But I would suggest that when you're choosing a place that they're going to go out together and get something to eat, that they choose something where you're not going into a pizza restaurant which has 100% gluten-containing pizza, and that you can find a place to eat, even if it's something fast food where there are more gluten-free options, and you could potentially get that date to try some gluten-free so you don't have to worry about it and you can ease into the situation.
Boy, there's a lot to know about this. Do you have a section called dating advice on your website? I know you have a YouTube video called Sex and the Celiac, which is on our site as well, and folks, you need to watch that one. That is something you've got to see, and Alice did a great job on it.
Yeah, the Sex and the Celiac was a catchy title just to tell you about the reproductive health issues in celiac disease. Yeah, but that's we have we have the FAQs, the frequently asked questions, on the website, and it's important. We go through the first steps, of first accepting celiac disease, then scheduling an appointment with a dietitian, learn which foods contain gluten, learn how to read labels, research some of the vendors, cookbooks. So, cross-contamination and educating your family. I mean, some of the biggest frustrations you might have is, family meals, let's say Thanksgiving or the holidays are, upon us right now, and there's so many gluten-containing foods for the holidays, and that's something that people start to feel very sad. And I would say surround yourself with great gluten-free foods, and adapt some of those recipes that everybody might enjoy, like meringue. Meringue is naturally gluten-free. You can make meringue cookies and put chocolate chips and things in it, and nuts. If you don't have a nut allergy, there's all kinds of things that you can do with nuts that are really easy and simple to make, and so those are some of the the suggestions that I would have with getting started. And don't forget, if one person in the family has celiac, the entire family needs to get tested. It is a genetic disease, and you need to see a physician annually to make sure that you're following your gluten-free diet, and make sure that you look at the other vitamin levels too, because you might be vitamin D deficient, vitamin K deficient. So those are some of the, and have and make sure that you're looking at your bone density too with a DEXA scan. That's really important for follow-up.
And very important, very important. Because basically, if you're gluten sensitive or you have celiac disease, you are not absorbing enough nutrients, which could result in everything from, in your case, you had your teeth were they falling? They weren't falling out, but they were. You had issues.
They were just breaking in the back. Yeah, my teeth look, in the front, if you look at my teeth, everything looks fine. But if you look at the back of my teeth, actually, the dentist, before the veterinarian diagnosed me, my dentist he said, you have something systemically wrong with you, Alice. Your teeth, I don't know what's going on with your teeth, are starting to crumble, and my gums were bad. But that's why I recommend that, you look at some safe, gluten-free substitutes that are also healthy. There's almond meal flour. There's coconut flour, and coconut flour is a delicious and healthful alternative flour that's high in fiber. It has a natural sweetness, and it's added moisture to baked goods. It's really yummy. And even like something, if you want to think about eating out, think about some of the other ethnicities. Like garbanzo beans are naturally, gluten-free, and there's garbanzo bean flour, and a lot of the Indian food is just naturally gluten-free. So I told my family, we went from like trying to eat Italian to other foods that were natively, gluten-free by design, gluten-free, and not trying to be something else. And there's a whole variety of foods that are just naturally gluten-free and delicious.
Mm. Mm. And unfortunately, many people think it's a death sentence just having to go on a gluten-free diet. It's like, oh dear, I can't live like that. And they don't realize that there are some great alternatives to this.
Yeah, really great alternatives, and it's just expanding, expanding that mind, expanding you to think about all that, again, the foods that you can have rather than, and focusing on what you can have rather than what you can't have. And, even now the flours, there's lots of manufacturers that will mix all the flours together to get a really good base flour so that you're able just to substitute one for a cup, one for one, so that you're, before when I was diagnosed, you had to mix like 5 different flours together to try to get the consistency of a flour that was like a a gluten-containing flour. And now they have pre-mixes. Still, the mixes are a little more expensive than the gluten-free, counterparts, but they've gotten much tastier. And, some of the breads out there's some amazing, brands that are on the marketplace right now that you can find in your, in your grocery stores. And, we're starting to see more, chain restaurants and carrying gluten-free products, and we're really trying to push into schools and universities.
Mm-hmm. Again, I have to say, it's just fascinating what you're doing. I really applaud you. And the questions just keep coming in. And folks, Alice, as you know, you can always send me a chat or a text whenever you feel you need to. We need us to wrap this up. But I just have to mention this, folks. Alice is on the East Coast, and she has to get up early in the morning for another meeting. So certainly want to answer it as you possibly can, but please don't be offended if we do not get to your question tonight. We will email contact information that you can have your questions answered. And now this is going to be in your hands, really. I'm going to keep asking these questions until you let me know.
Okay.
Okay. All right. Because here's a question: How do I start a celiac support group?
How do you start a celiac support group? Well, I would say that the first thing that you need to do would be to, contact one of the national support groups, and there's a couple of them, and they're listed. If you go to celiaccentral.org, they are listed on, they're listed on the website, and see, if there are any other chapters in your, in your area, or that they are looking to open a new chapter, because you're going to have to get you're going to have information on how to get the support group up and running, and then you're going to also need to have a medical advisor. But again, if you go to the website, you'll see the support groups listed, and then you can contact the national, the national organizations, and ask them how you would start a support group in your area.
If a blood test to diagnose celiac is negative, is it certain that you don't have it?
It's not 100% certain. There are some people that are, that it's an exception to the rule. So, again, there's great specificity and sensitivity to the blood test, but there are some people that are outliers. And, there are people that do very rarely but do have a negative blood test. And, if you're that you go on and get an endoscopy and the villi is still flattened. There's another test that goes along with the serology, and that's a gene test, which is the HLA testing, the DQ2 and the DQ8. So if you think you might have celiac disease, and your blood test is negative, you might want to get the gene test to see if you have the gene, and then talk to your medical professional and take it from there. It could be that you don't have celiac and you are gluten sensitive.
Right. Here's a question from India, and I remember during your talk, apparently a huge population of Indians, Asian Indians, that is, are gluten sensitive, right? Okay.
Yep, that is true. And actually, on the cover of my brochure, I do have someone who's, I do show someone who's, there's a huge population of folks that are Indian that have celiac disease. That is true.
All right, so Maria, you tell us what time it is over there. But Maria from India wants to know, would a gluten-free diet benefit rheumatoid arthritis as well?
This is a field of study. They're looking at, and we've been talking to a number of medical professionals on this. There, first of all, some people that have have certain autoimmune diseases might be misdiagnosed with another autoimmune disease. I've read some stories, and actually we had somebody who was diagnosed with MS, and it was actually the fact that they had celiac disease. Autoimmune diseases tend to run in the family. Rheumatoid arthritis, you typically think about, cutting out the nightshades with rheumatoid arthritis, and there's a whole functional medical program for folks with rheumatoid arthritis. But I'm hearing a lot of folks anecdotally who are on a gluten-free diet. It has helped their rheumatoid arthritis. I would suggest, to try. It cannot hurt. Try a gluten-free diet and keep a food journal, and take it from there. But we are now looking into, the gluten-free diet for other autoimmune diseases as well.
Maria said it's 9 o'clock in the morning in India. Bless you. Okay. New doctors.
There's actually a link. I just want to say there's a link now. They're saying gluten is linked to actually asthma. There's a group of European researchers who found an evidence to support that many with celiac disease believed for years that there's a connection between, gluten intolerance and asthma. So they're learning more and more about this.
Wow. It almost seems like it's a basic. It affects pretty much every system in the body, almost like.
Yeah, it's a multi-system disease. Yep, you got it.
That is crazy. That's crazy. Okay. Are new doctors training at medical schools now being taught more up-to-date information about celiac disease and gluten sensitivity?
Oh boy, I hope so. Yeah. My daughter is actually first year in medical school, University of Pennsylvania, and she's giving me all the scoop. Again, it takes time to get the most up-to-date information into the medical curriculum. But our medical advisory board is very busy working on that to ensure that the medical school curriculum is up to date. But you have to remember, this whole field of gluten sensitivity is in its infancy. I mean, it's really early on. The study of gluten sensitivity is in a formulative stage. So a lot of what happened is, because patients are coming in and saying, I don't feel well on gluten, and there is going to be a conference on gluten sensitivity this spring. It's going to be taking place in Iran. So there's a lot. This is an up-and-coming field of study, and the medical schools are it's starting to incorporate the study of celiac disease and gluten sensitivity into their curriculum.
Well, it's about time. I think they should do that. Very, very important. It will save a lot of people.
Well, there still needs to be, of course, as we all know, more courses on nutrition and in medical school. And I think that's really important, that anybody who has an influencer is an influencer, that is so critical to our medical school education, because food can, we're learning. The more we're learning, and the more we learn that we don't know, right?
Right.
And when people are asking me, one of my most common questions are, why are all these people sensitive to gluten? Why did so many people have celiac disease? And again, is it we don't know. There's a number of different hypotheses, but nobody knows the answer to that question.
Right. Right. But at least we know what to do about it. Okay.
That is true.
Here's a great question from Jennifer. How do I get trained to be a guide for restaurants? Is that a volunteer or paid position?
No, there is a great guides program, and again, Becky Moreland is Becky at celiaccentral.org is in charge of our great guides program. So again, it's Becky at celiaccentral.org, and she can get you information on the great guides program.
Okay, great. And Berta from Canada wants to know, what are some of those flours that are available? You know what she's talking about?
Gluten-free flours that are available?
Yeah, I think that's what she means.
I would say go to celiaccentral.org, and there's a whole list of, you go to, it's called Getting Started, and it's a guide on the gluten-free diet, but there are the flours that are available. There's all, there's almond meal flour, amaranth, buckwheat, coconut flour, cornstarch, garbanzo bean flour, potato flour, sorghum flour, and then if you're looking for the different flour mixes, like the ones combined together, like companies like Bob's Red Mill, there's a whole number of companies that make a cup-for-cup substitution for an all-purpose flour. Just if you go to your local supermarket, you'll look go down the aisle and you'll see look for a gluten-free all-purpose baking flour, and there's lots of brands available.
Great. All right, last question for the night. Is anything happening in Australia? This is Joan asking a question from down under.
Joan, yes, lots happening in Australia. As a matter of fact, Australia has a great awareness of celiac disease, and Bob Anderson is actually the researcher. He's on our medical advisory board at the National Foundation for Celiac Awareness that is looking into a vaccine for celiac disease. So there's a lot of great research coming out of Australia. Now he's moving to the United States, but we do have there's an international celiac disease coalition, and we're all working together internationally to help each other and share information so that the whole world is working together, to help each other. So, and Australia is, a big part of the celiac community.
That's good. Now, have you been there to do any talks, Alice?
I have been to Australia. Yes, I have. I've been to their expo and to a national meeting. Yes, I have. I love Australia. Especially, I love Australia in the winter time when it's summer, but I loved Australia. I actually went in the summertime, and it was still beautiful. It's really a wonderful country, and I felt I feel very blessed that I get to asked to speak in some of these incredible locations. So Australia was one of them.
Well, you're certainly living your dream and helping millions of people in the process. That's fantastic. We applaud you again, Alice. And thank you so much for taking the time to do this. And I mean, I noticed this too, folks. During the last when I met her in Dallas, she stayed behind to answer every last question. And there was a line of people after the presentation, and it was time for lunch, but she patiently stood through it all and attended to each person. So this is someone, as you obviously can see, that gives her whole heart and soul to helping people. And so again, Alice, thank you so much.
Well, thank you, Dr. David. Thank you for sharing with the entire the entire world all the work that we are doing together. And thank you for noticing that I do those things. You're very observant, and we really appreciate it. I think we're both on the same page together on the importance of health and healthful living. So thank you for inviting me to speak on this webinar. I really appreciate the opportunity to work with you.
You bet, and I hope we can collaborate in the future and help and educate people more and more, because this is a good work. Do you have any more last words you want to leave our guests with?
I hope everybody has a wonderful, healthful holiday season and New Year. And again, what I say for anybody that is just newly diagnosed with celiac or gluten sensitivity, that just focus on all the great foods that you can have around the perimeter of that supermarket, all those fruits and vegetables and all the foods that are naturally gluten-free, and don't be too tough on yourself. Just take everything one step at a time. And smile.
Absolutely. We can do that. All right. Well, this wraps it up for tonight, folks. Thank you so much for joining us in this big special. I told you at the beginning it was going to be a good one, and it's been proven to be just that. Wish you guys a wonderful evening, the rest of it, and a wonderful weekend. God bless. You all have a great night. Good night.